Hello everybody, welcome to the Nurses Talk Shop. Hi guys.
Hi.
We are so excited to introduce the multi-Pulitzer, highly acknowledged neurosurgeon from the early 1900s. He's the founder of the Cushing Syndrome, and at the amazing age of 150 years old, we'd like to introduce Dr. Harvey Cushing and his lovely assistant Marissa.
Hi.
Welcome to the
Hi
show.
guys, thanks for having us.
Nice to have you.
So, Dr. Cushing, I would like to ask you, what is Cushing Syndrome?
Cushing Syndrome. I initially had a patient with it in 1912. It was a woman that presented with symptoms and I had no idea what it was. So I decided for 20 years to do research. Till 1932 I finally linked the adrenal overproduction of cortisol to an abnormality in the pituitary.
Increased cortisol levels can often be caused by an overuse of corticosteroids. Stress can raise your cortisol levels, or your body can just make too much of it itself.
Corticosteroids, especially glucocorticoids, are the biggest ones. And also 85% of the cases are from ACTH secreting pituitary adenomas or tumors on your pituitary gland.
Marissa, you said the use of steroids and stress? So
Either
like if
one.
someone was taking prednisone daily and if they're in nursing school?
Oh, I'm sure that could do it.
Okay. So how do you diagnose this?
Diagnosis comes from the confirmation of elevated cortisol levels. That'd be the first thing we test. We'd also use 3 different tests to confirm the diagnosis: the midnight or late night salivary cortisol test, the low dose dexamethasone suppression test, or the 24-hour urine cortisol test, where we test urine for 24 hours, and if it was greater than 120, that would indicate you have my syndrome. On top of that, we would also use a CT or MRI to detect adrenal or pituitary tumor.
And then
Go ahead.
the treatments for Cushing syndrome, it depends on why your body's making the excess cortisol levels. If it's from the corticosteroids, you would just decrease the amount that you're taking. There could be a tumor, an adrenal tumor or a pituitary tumor that would need surgically removed, or medications to balance out the cortisol levels.
So they might need surgery. Can you go through radiation too?
Yeah, that is a
Okay.
possibility.
So what are the symptoms of it?
The most prominent symptom is weight gain, especially around the abdomen. They also develop adipose tissue deposits in their face, causing what we call a moon face, or they have them around their cervical spine area, which we refer to as a buffalo hump. The next thing is hyperglycemia. You have poor glucose control because of cortisol-induced insulin resistance. And then they would also experience osteoporosis, which would lead to many complaints of back pain.
Thin and fragile skin that bruises easily is also a symptom. Slow healing of cuts, insect bites, or infections. And then acne is also a symptom. In women, they experience increased body or facial hair.
Kelsey, you have asthma and you do take corticosteroids daily.
And she's in nursing school.
And she's getting a lot of pimples. Maybe that you have this syndrome.
Are red cheeks a symptom of this?
Yeah, they are. Also, purple and pink stretch marks on the skin of the abdomen,
And
thighs,
you
breasts,
bruises.
or arms.
And menstrual irregulars.
Yes, we have an issue with your menstrual cycle. Men will also experience gynecomastia and impotence.
So, I think I need to go to the doctors.
Well, Dr. Cushing can look at it.
Yeah, I think I might have Cushing's.
Yeah, and while we're on this show, you
Can
can
you
talk to us about it. Show us, yeah.
Oh, you definitely have some pretty large signs.
Oh.